I've never seen the numbers be as high as they are. And I think what's one of the most challenging things is it's devastating. Day in and day out, these nurses are coming in and they're spending so much time with these patients because of how sick they are. And when the patients decompensate, it happens very quickly. So a nurse won't be able to be in two rooms at the same time. So when she tries to go to another room, a lot of times the patients have decompensated so quickly that the physicians are already telling them to call the family because they have a pretty grim outcome. It's really hard for nurses because one of the reasons that they wanted to get into healthcare is because we wanted to help people. We wanted to fix things and make people better. So what's really challenging is to come in and every day, day in and day out, we're seeing the same devastation, the same poor outcomes, and it's taken a toll. And my fear as a nurse leader is that I don't know how to support the team and how to help them because they're so distraught with the death and devastation that people are walking away from healthcare. They don't even want to work at a different hospital, at a different facility. They don't want to be nurses anymore because they feel like no matter how hard they work and no matter what they sacrifice, it's not enough. So it's hard when there's so much misinformation that's easily accessible. I'm just begging people to check their sources and talk to physicians, look at the science, and understand that the vaccines are efficacious and they work and we can actually help save lives. And I think, yeah, the one-on-one with the patient, but it's so much death. And it's so many poor outcomes that's replaying over and over and over. And it feels like no matter what we do, it's never enough. When there is a chance that people could get vaccinated and not be in that situation, right? So that's one of the most discouraging things is to know that it didn't have to be this way for you. Could have made a difference. Out of all the patients that I've touched and taken care of, held their hands while they were so sick, while they passed, called family members, of all of those situations, I can't tell you one of them that was vaccinated.